So, hello students, welcome to Navika Educator channel. Here there is a solving a previous year question paper, 2015, 16, 17, 18, 19 up to 2022. So RRB staff nursing previous year question paper. So today we will, without wasting a time, we will move on to the question paper. So now 8th February 2015. On that day, there was RRB staff nurse was exam was conducted. Okay, let's move on to the questions. Okay. So now here I am entire there are 100 questions are there. Now I am explaining that nursing related questions. Okay. So now first question number 7. In that question number 7, I chosen that only nursing related questions. The light of which the color is used to treat a neonatal jaundice. In that here there is a blue light. For a detection of the neonatal jaundice. Okay, so there is 430 to 480 nanometer they are using for detection of the treat of neonatal jaundice. Identity of part of a human stomach are connected to a joint of a esophagus. So the answer is cardia. So cardia is the connection between esophagus and stomach. Which of the following is infections hepatitis? That is called hepatitis A is the right answer. Which one of the following vaccination is the necessary for a pregnant body? So, pregnant lady. That is called a tetanus. BCG vaccine that is called a TB. And rubella vaccine they also can use for various diseases which is called mumps. Okay. And DPT it is another vaccine which we can use for children. So what is the chemical name of the aspirin? Answer is acetylsalicylic acid. The first stool of a neonate is called meconium. So which of the following is a test used for a detection of the typhoid is called Vidal. So BCG it is a vaccine and VDRL it is used for syphilis. Okay, so answer is Vidal. This is Vidal test. What is the gout? Gout it is a metabolic disorder. Here there is a storage of the uric acid in a joints. The next, thalassemia is a congenital. It is a blood disorder. So blood disorder, there are various kind of disorders are there: anemia, hemophilia, thrombocytopenia, hemochromatosis. Okay. Next, Hodgkin diseases, leukemias, non-Hodgkin lymphomia. These are called other type of blood disorders. Rice water stool is a symptoms of cholera. Will tumor affect which of the following? So the answer is kidney. So this is the affection of the Wilmer tumor. Which one of the following blood group is a universal receptor, that is called AB? Universal donor is called O blood group. Bulimia, nervosia and anorexia nervosia. This is the eating disorder. The general side of effect of a penicillin is rashes and itching. Saline chart is used for a measuring, that is called vision. As you already observed in a clinical perspective, you might have seen that this kind of a chart, that is for vision. Which one of the following ion help in the blood clotting? That's called calcium. Calcium is the right answer. The weight of an infant body become twice the birth weight at the age of 6 months. Is the right answer. MMR vaccination is done for a protection against the measles, mumps and rubella. This is the right answer. Which one of the following is a test for diphtheria? That is called Sikin test. This is the test for diphtheria. And one more test which is called Montoxi test. This is for tuberculin test, TB test. So with the help of injection, they'll take a sample from this. Vidal test which is typhoid. VDR test for syphilis. The number of chromosome in a normal human cell, which is called option number A, 46. Paracetamol, it is not given those patients who are already suffering from. Which one is the right answer? That is called a kidney disorder. Which is the most effective method disposable in hospital-based management? There are by recycling, by compositing, by dumping, by insertion. The best answer is best effective disposable based hospital based, which is called insertion. Yes. Which is the basic functional unit of a kidneys? That is called nephron. The disorder of affect in a memory and cognitive function in an older person. The older person in that case there is called dementia. So there are other dementia. Dementia it is the effect of thinking and a language problem and a difficult to judgment behavioral problem. Okay, so it is not a specific effect. These are the various kind of symptoms who had dementia. Okay, so now here there is called insomnia. Insomnia it is a sleeping disorder. Disorder. Okay, so parasomnia it is also a feeling of distrust and mental illness. And aspias Apsia. Apsia, it is a language disorder and it is mainly infected into the left hemisphere. Left hemisphere. Okay. So difficult to reading, difficult to understanding the language, difficult to writing. These are the problem who had apsia. So some scientific word it is difficult to pronounce. Anyhow. Which one of the following cancer is associated with a high fat diet? Yes, the answer is colon cancer. This is a colon cancer. So insulin is not administered through a oral route because it is mainly destroyed GI tract, gastrointestinal tract. Green leaf vegetable are rich sources, vitamin A. See, these are the simple kind of a question they'll ask in an examination. I think this is a 2015. Let's see, we will solve 2016-17 and what kind of a question they may ask. The heartbeat rate in a newborn babies is generally 120 to 140 beats per minute. Disulfiram is a drug used for treatment of alcoholism. Is the right answer. So fertilization process takes place in fallopian tube. So this is a part of a fallopian tube. In the fallopian tube, there is a fertilization is going to take place. Not a uterus, not a vagina, not a ovary. The right answer is fallopian tube. Hair color in a human turn white due to the absence of which of the following is pigment. It is called melanin. Which one of the following is due to a deficiency of a vitamin D? That is, answer is ricket. So these are the deficiencies. The white line formed in a lower part of the abdomen during the pregnancy, which is called a linea nigra. This is the name of that abdomen during the pregnancy. So in this place there is a line. Which one of the following called as a powerhouse of the cell? The mitochondria. The main symptoms of pingitus is called a large vesicles, not a small, not a bluish, not a red. Large vesicles. Chickenpox is caused due to infection by not a fungi, not a bacteria, protozoa, no. The answer is viruses. Which one of the following teeth are used crushing and grinding food? That is called premolar. The feeling of a fetus movement by a mother is known as quickening. This is the right answer. And it's a Namika here, and consistency is the key to success. And now I explain nursing related questions in that 2015. In a part 2, there will be a part 2 is there. So part 2 in that general aptitude is there and general awareness is there. So those are the questions we will solve in next classes, I mean in a part 2. Thank you and all, and study well and be prepared for RRB staff nurse. In 2024, they are already given a notice. That notice, the date it will not announce, till date is not announced, not announced. So be before now only. Thank you one and all.